like the music. Good afternoon. This episode is brought to you by Navco Pizza, which is in the shopping center on Navco Road and McVeigh Drive.
Navco Pizza 1368 Navco Road Mobile, AL 36605.
Good afternoon again. This is V with What Matters Gulf Coast. This is our third in a three-part series on issues impacting our communities. We have had untaxing groceries, criminal justice reform, and today our topic will be Medicaid expansion. We have had a very hard time, difficult time trying to get in touch with a very busy lady. And she has been so busy because her particular topic is very popular and it is a hot item. And people all over the state want to get the information on the pros and cons on and how expanding Medicaid impacts Alabamians. We do appreciate our guest today, Miss Jane Addams with the Alabama Rise. And folks, let me stop just a minute here and talk to you. If you are not familiar with the organization Alabama Rise, go online and read about this organization and all of the issues that they're involved in. You will quickly see that the organization has our best interests in mind and fights battles for all of Alabamians. Now, back to the introduction of Jane Addams, campaign director for Alabama Rise. Jane is going to speak to us on the needs and the benefits of expanding Medicaid. I know if you're like me, you have heard over and over again expanding Medicaid would cost the state so much money and that the state would not be able to continue to afford to continue funding it. Well, folks, today we will hear the real deal and find out the ins and outs of the prospects of expanding Medicaid. Let me tell you a little bit about Jane Addams' background. She is a ninth generation Alabamian. She earned her master's degree in theological studies from Wesley Theological Seminar in Washington, D.C., where she studied the ethical implications of public policy on poor people. Before joining Alabama Rise in 2020, Jane worked as a senior policy analyst for Bread for the World. While at Bread for the World, she co-chaired the Save for All Coalition, which is the largest anti-poverty coalition in the United States. Jane has also spearheaded strategies for the Interfaith Health Care Coalition and the Faithful Farm Bill Coalition. The next person you will hear is Jane Addams, and she will be speaking to us about Medicaid expansion. Jane?
For having me. What's up? What Matters Gulf Coast listeners? Today, I'm going to talk a little bit about healthcare in Alabama. And that might be an interesting personal topic for a lot of folks that are listening and watching, because we all interact with healthcare. We're all, worried about access to healthcare, the affordability of healthcare. Am I sick? What happens if I get sick? What happens if my kid gets sick? It is truly one of those, I wouldn't say kitchen table, but Vice President Kamala Harris calls it those things that keep you up at night issues that spans across political parties, spans across generations. And that's because healthcare in Alabama is not strong. It's not focusing on individuals and their outcomes. It's not focusing on cost savings and access and quality care. And it's not focusing on investing in a healthcare system that is meeting the needs of just everyday Alabamians. So the reason I got started in the healthcare work, what made me curious about healthcare is my brother. My brother has some mental health issues, ADHD, and is neurosensitive, is on the autism spectrum. And he's just always struggled to keep employment because he gets real anxious and kind of like socially shuts down sometimes at jobs, which then makes it difficult for him to ever want to return back to them. Medicated and regularly seeing a therapist and a psychologist keeps my brother in a place where he can productively work. So his medications are absolutely important to him being able to kind of function in a workplace. I remember when the Affordable Care Act was passed in Barack Obama's presidency. You might know it as Obamacare, but it's called the Patient Protection and Affordable Care Act. And included in that legislation that kind of made healthcare a little different across the United States, there was a provision that would require every state in the United States to expand Medicaid. Now, before I get into Medicaid and Medicaid expansion, let's talk about what Medicaid is. One of my professors put it best when they were trying to help us as students learn about the different health systems in the United States. And a lot of folks get tripped up. Medicaid, Medicare, private plan, deductible, blah, blah. There's so many different terms. It's meant to confuse you. So if you're confused, that's the purpose of our system. It's not user-friendly. But Medicare is for people 65 years old and older. And so typically those are the people that have Medicare. It happens when you reach a certain age to make sure that folks that are later on in their life, living in their golden years, can have access to health insurance to live a healthy and productive life until they pass away. So Medicare, gray hair, that's how I remember it. Medicaid is a program that is to treat poor, vulnerable populations. And when I say poor, I'm not talking about just like very, very poor folks. I'm talking about people who are low income, in between jobs, perhaps stay-at-home parents, caretakers, folks who are working in the service industry. Now, you may not consider yourself to be poor, but the reality is that if you look at the income index and Alabama's cost of living and the cost of groceries and inflations, a lot of folks have moved in to a poverty status, or they're living paycheck to paycheck. I like to, folks typically refer to them as the working poor. That's what Dr. Martin Luther King referred to them as, is the working poor. So Medicaid takes care of those folks, provides health insurance to them, also pregnant folks, people who are medically fragile, folks who have a disability, folks who need emergency like some sort of emergency mental health treatment, emergency substance use disorder treatments. That's the population that it was created to cover. So when the Affordable Care Act passed, they intended for it to expand the who could be in Medicaid, because there was an inequity happening. The program hadn't been updated to reflect the changes in cost of living, inflation, income, and because of that, you had a lot of folks all across the United States who were, stuck. They couldn't afford a health insurance plan, but they couldn't qualify for Medicaid. And so they just had nothing, no option to them. And so, the Patient Protection Affordable Care Act passed, and that Medicaid expansion was included in it. And then states sued because they said, hey, we don't want the big federal government telling us to expand healthcare for low income and poor, for the working poor. And they sued on that, and it went all the way to Supreme Court. And many of the provisions of Obamacare were held up. The Affordable Care Act were held up, and then many of the provisions of, other things were held up, but Medicaid expansion was not. The Supreme Court said you can't force every state to expand Medicaid. Medicaid is a state and federal program. It's not just a federal program, right? Like Medicare is, the one for old folks. That one is what we call an entitlement. Everyone's entitled to it when they reach a certain age. Same with Social Security. Everyone's entitled to it. But with Medicaid, you have to meet a certain eligibility. And it's usually based on your income or the kind of circumstance that you're in, like if you have a disability or something. It's kind of the same with SNAP, or formerly called food stamps. You have to have a certain income and be in a certain kind of situation. And some states had decided, hey, even though the Supreme Court has struck down Medicaid expansion and now said like the feds can't make states do it, our states are going to go ahead and move and do this because their Medicaid programs weren't meeting the needs of truly poor folk. And I don't know if we can go into my slides, but I have some slides here that I want to share with you. So my job as the campaign director at Alabama Arise is to lead our Medicaid expansion campaign. I mentioned my brother earlier. My brother needs medicine to be able to function and thrive. And when the Affordable Care Act passed, I remember helping him go on healthcare.gov, helping him on the website, helping him put his information in. And I remember seeing the fact that like the first time we entered in his income, we thought it was the correct income based on his W-2s and stuff. And so we entered it in, and the plans were so expensive. And I was like, my goodness, why are these plans so expensive? And it just didn't make any sense to me. My brother was like making like $13,000. Like, why were these plans so expensive? He should be able to get health insurance, right? He needs it. Like, he's a working poor person who needs medications. And so I called a healthcare navigator, and that's the first time I learned about Medicaid expansion. Before then, I didn't know much about healthcare in the United States. I didn't even know what a premium or a deductible or cost sharing or co-payment. I don't know what any of that is. Again, the system is hard to navigate. But I started digging into it more, and I saw that my brother fell in what is called a coverage gap, which means the state has failed to expand Medicaid, but providers my brother can't qualify for Medicaid because Alabama didn't expand Medicaid. when the Supreme Court left it up to them. And then the Affordable Care Act, as it was written, said that, you know, anyone from 138% of the federal poverty level, which I know we're talking about a lot here, but I have some slides to show you. Anybody from 138% of the federal poverty level, you know, to like 400% of the federal poverty level can qualify for what is called this ACA market subsidy plan, right? So like that's private insurance. That's your Blue Cross Blue Shield, your Kaiser, your whatever. But the whole ACA, the Affordable Care Act, was built on these 3 pillars. And the 3 pillars were Medicaid expansion, mandated Medicaid expansion, a robust private insurance marketplace that's affordable and accessible. And then the third thing was the individual mandate. If people didn't have health insurance, they got taxed as a liability. Now, the Supreme Court struck down the individual mandate portion, and they struck down the Medicaid expansion portion, but they left in place this ACA marketplace plan with subsidies. But I think that if Obama or anyone in Congress at that time, Nancy Pelosi or others, had known that the Supreme Court was going to strike down the Medicaid expansion plan, they would have made those marketplace subsidies reach the poorest folk. Because that's just common sense, right? Like, we know the best way out of poverty is to have access to quality, affordable healthcare and to be healthy so you can work, engage in your community, and make income. And, you know, there's lots of other things, food security, but a lot of it just has to deal with like as a child, can your parents afford to give you a good life? And are there opportunities? Are they healthy enough? Or do they have, you know, access to a community that supports them to be able to be productive, right? That's how our system, our kind of capitalist system works, whether you like it or not. That's just how it is. That's how people move out of poverty. We also know that health expenses, medical expenses, move more people into poverty every year than anything else combined. So on average, every year, 8 million Americans move into poverty, which means they were not poor. So this is that working poor we're talking about. They were not poor, but because of medical expenses became poor. And we see that happen every year, right? And the reason why it's happening is because there are 12 states that did not expand Medicaid. Again, there are some crooked stools that aren't standing anymore. A health system from that 3-legged stool. Alabama, you know, didn't do Medicaid expansion. And so you can look at our healthcare system with 14 rural hospitals and clinics that have closed, you know, 300,000 individuals who have no access to health insurance, can't go see a doctor when they get sick and be able to pay for it. People using emergency rooms just to get regular care when they're sick, to get medication, to get antibiotics, because they can't afford to go to a primary care physician or an urgent care and pay out of pocket because it's so expensive and they don't have health insurance. That 3-legged stool of Medicaid expansion, the marketplace with subsidies, and the individual mandate is a 1-legged stool in Alabama. And unless you are going deer hunting and staking that into the ground, that is not going to be a stable stool for you. So you look at our healthcare system in Alabama and it ranks low. We have high infant mortality, maternal mortality. We have high diabetes, high heart disease, cancer, you know, lots of folks who have untreated, you know, comorbidities that contributed to a lot of our COVID deaths. I think I saw recently that we had the third per capita, the third most COVID deaths of any state. Again, if your health system isn't effective, if it's not working the way it was designed to work, if you haven't implemented the coverage, you get a coverage gap. And that coverage gap means that hundreds of thousands of working poor Alabamians, moms and dads and aunts and uncles and grandmas and grandpas, don't have health insurance, can't go see a doctor, which puts a financial strain and a risk on everyone else's family, which means that your family isn't able to make financial decisions that are best for you, and invest that money back into the economy, right? Like every time they go to Burger King, they're giving $1 to Burger King, right? Every time they go to the grocery store, they're giving $1 to the grocery store. So if folks don't have money, they can't spend money, which means the community isn't seeing that influx of fiscal resources and the economic benefit of it. So when I talk about Medicaid expansion, I really want to talk about the coverage gap and that investment we need to make in our healthcare system. So here's a family of three: Betty, Sue, and Donnie from Decatur. Couple, young couple. Betty is having a difficult time finding regular work because she has to be at home with her little girl, Sue. Donnie is working at one of the local factories, does not provide him health insurance. Maybe he is an auto mechanic at or working construction. None of that provides him health insurance. Shoot, he can even be a barber. Let's make Donnie a barber. Barbers in Alabama don't have health insurance. Typically, they fall in the coverage gap. Maybe he is a bartender at a local restaurant, or even an assistant manager at a local restaurant, trying to work his way up the chain, no access to health insurance. In order for this family of three, minus Sue, minus the little girl, because children in Alabama have access to health insurance. But this family of three, based on the income that they have, they cannot afford either Medicaid or be on a marketplace plan. Because in Alabama, our Medicaid eligibility is so low, right? Remember I was talking about the working poor? The only way this family of three in Decatur would be able to qualify for Medicaid is if they made less than $3,910 a year. A year. So really, Medicaid does not serve low-income adults unless you're pregnant or disabled. It doesn't matter how poor you are. You can be making, $4,000. You can be making $6,000. You can be making $13,000. You can be making $18,000, and you're still not going to qualify for Medicaid or ACA marketplace plan with subsidies. So that means that when Betty goes and looks on healthcare.gov, what she's going to see is plans that cost $1,000, $1,300, very, very expensive plans for her and her husband. And so she can't afford that. Like, even on a one-parent salary where, groceries are expensive and childcare is expensive, she can't afford that. And so the reason she can't afford that is because they were supposed to be in Medicaid expansion, like the Affordable Care Act designed them. What Medicaid expansion would have done is it would require all states to provide Medicaid coverage to the low-income adults, right, who are not Medicare eligible, that make anywhere from 0 to 138% of the federal poverty level. And I just briefly want to tell you what the federal poverty level is, just so you know what 138% is. And it differs on your family size, but for one person, it's $13,590, right? So if it's just you, if you're just a college-age kid, or you're a single older adult that isn't eligible for Medicare, and you make less than $13,590 every year, you don't have health insurance in Alabama because you don't qualify for Medicaid unless your employer provides it for you, because you don't qualify for Medicaid because they didn't expand it, and you can't get a marketplace subsidies because those start at 138%, that 13,590. So anybody making in between, 3,000 and 13,000 in Alabama has no affordable health insurance. They likely don't have health insurance. We know that those individuals, that there are roughly about 300,000 in Alabama, We know that if we provided them health insurance, it would cut our uninsured rate in half, and be a huge economic boon to our communities. So this is what the coverage gap is. For a family of three, for these three folks, 138%. So that marketplace plan, that starts at $23,030. If he is working full-time or as much hours as he can as an auto mechanic, he's probably making minimum wage starting out, right? Or definitely less than $15 an hour, maybe. You look at all of that, and she's not working at all. That is a lot of folks that fall in that poverty gap. So if Alabama expanded Medicaid to 138% of the federal poverty level, as the Affordable Care Act was designed for them to do, the federal government will cover 90% of the cost. So Alabama state, our state tax dollars would only have to cover 10% of the cost. Initially, if they would have done it right out of the jump when the ACA was passed, it would have been covered for 100% for 3 years. So we would have got it for free for 3 years. I should preface that there's only 12 states that have an expanded Medicaid. So if you go to Arkansas, Louisiana, or Kentucky, or even Montana, you would have access to Medicaid expansion. If you're a low-income adult, you would have access to Medicaid expansion. And again, that's because their states decide to do it. 38 states in the District of Columbia have expanded Medicaid. The 12 holdout states, 9 of them are Southern states. So again, the Southern states just refused to invest in a healthcare system, refused to invest in working poor families. And because of that, we have suffered. And I'll get a little bit into the why we have suffered in a second. So 340,000 people fall in this coverage gap. I live in Huntsville. If you were to line up, like stack everyone on top of each other, right? And just like say an average person is like 5'7", 5'8", and you were to stack them all on top of each other, all 340,000 of them. The Saturn V rocket right there, the big one, if you would stack 1,170 of them on top of each other, that's the size of the coverage gap. People, like actual people. If you were to line people up shoulder to shoulder, it's 70 miles of people, shoulder to shoulder, of people in Alabama that have no health insurance because of our failure to expand Medicaid. I do show that because I want people to know it's huge, right? And it's not that in Arkansas. Everyone there has access to health insurance. It is not that in California. It's not that in Kentucky or Louisiana, states that have expanded Medicaid. It's not that. Those people have health insurance. There aren't rockets that are stood up. And so another reason why we should expand Medicaid is because Medicaid expansion empowers Alabama. It will provide access to preventative care, more primary care physicians. We're in a doctor shortage. Access to medication, mental health, and substance use treatment. Increased financial stability because people won't have medical debts and won't need to either file bankruptcy because of medical debt. And, we'll be able to continue to get treatment for an illness that can keep them working and employed. Again, a healthier workforce, right? All those folks that are working at those fine factories that keep popping up all over the place to move out cars and car parts and all sorts of other stuff in Alabama, a lot of those folks don't have health insurance, right? So you want a healthier workforce as a small business owner or a business owner. You want your employees to be healthy. And shoot, I know how many people in the service industry, that means your restaurant waiters, cooks, and service employees, when you go to a restaurant, I know how many of them don't have health insurance. And as just a concerned consumer, I do not want the person that's fixing my food to be sick. I want them to be able to go get whatever kind of medicine they need for their cold or whatever and take a day off and not serve me food. So again, healthier workforce and at least a healthier families. We know that when parents have access to health insurance, their children are more likely to also have access to health insurance and see a doctor regularly. That's just a fact. We know that. And how do we know that? Because 38 other states have expanded Medicaid. Again, there's only 12 states that haven't. So one of my jobs at the Cover Alabama Coalition is to lead grassroots organizations and organizations that care about this issue to really focus a big campaign into convincing Governor Ivey and our legislature to expand Medicaid. And it takes a lot of work. We've built a coalition of 115 organizations across Alabama, including the Medical Association of Alabama, the American Heart Association, Cancer Society, Greater Birmingham Ministries, the Bay Area Clinic, the clinics in the Mobile Bay Area, hospital systems. Again, like we bring all of these people because they have seen what has happened in the last 10 years in Alabama's healthcare system and know that Medicaid expansion will solve that. They can look at Arkansas, they can look at Kentucky, they can look at, Colorado at their healthcare systems and know that they're more effective, putting more dollars into the economy, but also treating people to make sure that people are healthy. So we had a group of medical professionals. It's now up to 300 medical professionals who sent a letter to Governor Ivey in 2021. And the letter said, we have to deliver life-altering news to patients and their families daily. So much of this pain could be avoided or mitigated through preventative care and early detection. Please help us save lives and reduce suffering by expanding Alabama's Medicaid program to cover adults with low incomes. Some of our biggest champions are doctors because they see it, right? They see patients who come into the emergency room or come into a clinic who are maybe just got health insurance and had been uninsured for 10, 15 years, who have untreated cancer, right? That has spread all throughout their body, or chronic respiratory illnesses, or untreated, unchecked diabetes, heart disease, seizure disorders. So it's just everything, but everything down to a flu that can take somebody out. So I appreciate our doctors and the work that they're doing on this issue. Another thing that you need to know is 66% of Alabama farmers have said that the pandemic has impacted their mental health, right? So when you talk about farmers, this is a key population across the state, folks who are farming. A lot of those folks are self-employed or their income is just so flexible, or maybe they don't own the farm and they just work there, farm workers. Their mental health, we've seen high suicide rates for farmers, just they keep increasing because of how kind of unsteady the economic times are. I mean, they are for everybody, but especially so for farmers. So we see farmers, their suicide rates increasing. A lot of those folks are in the coverage gap. They don't have access to health insurance. And we know that mental health care and robust mental health services can address that, right? So we are, when we're thinking about people in the coverage gap, it's not just your restaurant employee or your childcare worker, it's farmers. It's people who own small businesses, who have no health insurance. Medicaid expansion is an investment in public health. Since 2010 to present, Alabama has had 14 rural hospitals and clinics close across the state. In Arkansas, which expanded Medicaid, They have had one hospital closure since 2010. And that hospital did not close because they were not financially good. It was because the director was up to some shady stuff. And so that's the reason why that hospital has closed. They have clinics in every county that serve low-income adults and Medicaid patients. They have a robust healthcare system in Arkansas. You know, if you drive 5 miles up the road, you can get healthcare, you know? And really, it should not matter. Somebody with the same income in Arkansas and in Alabama, we think it really should not matter what zip code they live in. That folks need access, right? I'm not saying we give it to everybody for free. I'm saying access to affordable health insurance, right? Just the opportunity to at least have affordable health insurance. It's their choice whether or not they use it. But what we've seen in states that have expanded Medicaid is more doctors, hospitals, and clinics. We've also seen increased revenue at state and local levels, job creation. One of our projections from the Public Research Council of Alabama shows that Medicaid expansion would create, nearly 30,000 jobs over 10 years. And it creates a dynamic economy. Hospitals are sometimes the largest provider in a community. They serve largest employer in a community. Everyone from nurses to doctors, but custodial staff, tech managers, cleaners. I mean, we're just talking about everybody. They create a lot of jobs and creates a dynamic economy. Okay, this is a little confusing, but let me just get to this. So the federal government wants us to expand Medicaid because healthier people means the economy is better, right? If you have better healthcare that is able to compete really well, again, capitalism. Healthier people means people live longer and they don't cost the state as much money. And that's more tax dollars and revenue, right? So investing in healthcare is one of the biggest investments, whether you're federal, state, community, whatever you are, even just like a church, right? Or if you wanted to invest in a clinic or something. Investing in healthcare is one of the best ways to reduce poverty and one of the most economically stimulating policy solutions. So remember when I said that it would have been free for Alabama to do this for 3 years, but Governor Bentley just kept saying no. Well, now Governor Bentley supports Medicaid expansion because he's seen the outcome of it. However, it's not 100% free anymore. The federal government has made it even more free. So we still have to do the 90-10 where the state pays 10% of the costs, which is an average of $200 million a year. But our state would save $600 million. $300 million every year in our general fund budget because we've been paying for certain populations to temporarily get access to Medicaid at a higher rate. So it's like, the best way to explain it is our state failed to expand Medicaid, but kind of like put Band-Aids all over our health system's problems, said, well, we've got a real problem here with opioid and substance use, so we're going to allow for Medicaid to temporarily cover these folks. But Medicaid was covering those folks. Sometimes 40-60% of the cost was on the state taxpayer and Alabama Medicaid, right? Not federal government. It was our tax dollars, 60% that was covering that, which again, not a bad thing. But if we would expanded Medicaid, those folks would get access to treatment all the time, and the federal government would cover 90% of it. So it ends up saving state tax dollars because the federal government pays for the vast majority of this. Now, again, people are going to say, oh, well, how does the federal government get this money? Is it just debt or whatever? No, it's your taxes that you pay every year. When you cut Uncle Sam a check, right, and send it off to him for however much at tax time in April, you are paying for Medicaid expansion, that federal share. But you're not seeing it in Alabama. You're paying for Medicaid expansion in Arkansas, in California, in Hawaii, in Alaska, in Louisiana, in Oklahoma, in Utah, you're paying for Medicaid expansion already. And you have been for a long time. In fact, you have been for so long that it's what the federal government, quote unquote, calls paid for, which we can get into later. But something that's been paid for 10 years in the federal government is considered fully paid for because of the way the budget works. It's kind of confusing. Yeah, so you're paying taxes for Medicaid expansion in Arkansas. And in fact, Alabama taxpayers, an estimation shows that Alabama taxpayers have, since 2010, 2 billion with a B of their tax dollars have gone to other states to pay for their Medicaid expansion. So again, this is a lot of tax dollars that we could be bringing back home and investing into our own community, and again, saving state tax dollars. Now, sometimes I go talk to Republicans in the legislature and they call this funny money. It's not funny money. It's just economics, right? Like, if there were a better solution to invest in our healthcare system, I would support it. But there isn't a more affordable, economic-driven, data-proven program to invest in your healthcare system by making sure the working poor have health insurance than Medicaid expansion. 38 other states have done it. We have tons of evidence of how it needs to be done, which is why Governor Bentley came out this year and said he wanted to, he was urging Governor Ivey to expand Medicaid. Conservative states have done this. Progressive states have done this. Lots of states have expanded Medicaid, just not Alabama and some of our neighbors. So if we expand to Medicaid, the Affordable, the American Rescue Plan Act and some of those COVID stimulus bills made it even more of a financial incentive for the state to expand. So over 2 years, not only will the federal government pay 90% of the cost of the services for that, those 300,000 people who get health insurance, but they would give us an additional $743 million over 2 years in the regular Medicaid population, so the people we're currently serving, because Medicaid covers about 1 million people in Alabama, and those are children, mostly children, through the Children's Health Insurance Program, or all kids, the folks who are disabled, and pregnant women, and folks who need emergency mental health treatment. But the vast majority are children. So what the federal government will do is invest $743 million more of federal funds in our regular Medicaid program, which is an investment mostly in children. So, so again, for 2 years, we get that investment and we can spend it or bank it or however we want to do. Here's another thing. I said earlier, about 30,000 jobs will be created for Medicaid expansion. I want to just kind of get into what those jobs would be. 14,000 in the healthcare industry, 82,000 in like billing and marketing, like those types of things. 32,000 in retail jobs. You think about a retail store, like if a hospital or a clinic moves to your community, people want to set up a shop near the business. 2,100 jobs created in construction and 800 jobs created in like financial services. Now we know there's going to be a bunch other, but we can project these through economic projections. Yeah, so here's a perspective for you. Medicaid expansion in its first 4 years would create nearly 80% as many jobs as exist in Alabama's automobile and auto parts manufacturing industries. Medicaid expansion does a whole lot more. It creates a more equitable Alabama, reduces racial health disparities, creates more access to care in rural communities, reduces mortality rates, both infant and maternal mortality rates, reduces recidivism, and provides access to substance use treatment. A lot of the folks that are going to our jails and prisons are going there because they have an untreated mental health issue and need emergency services. They don't need to go to prison. They need to go to the doctor. So states that have expanded Medicaid experience savings in their criminal justice and social services budget. And that's from a report from the State Health Reform Assistance Network. So this is a letter from law enforcement officers that was sent to Governor Ivey. It had about 50 or so law enforcement officers from across the state. It said, we support the expansion of Medicaid because we know that mental health care and alcohol drug treatment services can reduce both unlawful behavior and arrest rates. Medicaid expansion also will create a safer environment for Alabama law enforcement officers to do their jobs. You think about a lot of the cases around police violence, excessive force, those types of things. A lot of those things happen because they're coming up against people who are going through a mental health crisis. And a mental health crisis can be scary. I hope none of you have had to experience that personally or seen a family member go through it. But it's like the person isn't there anymore, right? And you are trying to navigate and calm down the situation, and things can get really scary really quickly. So again, law enforcement officers want Medicaid expansion because people will have more access to health insurance and mental health care, but B, it creates a safer environment for them when they are called out. States that expanded Medicaid had fewer initial contacts by law enforcement due to greater household economic stability and increased access to substance use and mental health treatment. So again, the cops are not coming as much because people have access to health care. Now, a little bit more about Cover Alabama and what we do. So we're an advocacy coalition. We're not our own organization. And you can check us out at coveralabama.org. If you have an organization, right, like a nonprofit, a 501c3, you could be a church, you could be a civic group, and you want to get engaged in convincing Governor Ivey to expand Medicaid, which we're getting so close. I can tell you that. I don't mean to make a big deal about it, but even during this call, I get calls from the governor's office. So we're talking because she wants to do something to address the problem. We're just trying to convince her that the solution is Medicaid expansion, and to not be afraid of it just because it was tied to Obamacare, right? Again, Montana is not a liberal bastion, right? It's real conservative Arkansas, So we joined together as a coalition to protect Medicaid in its current program and find solutions to expand it. We're nonpartisan. We work with Republicans and Democrats. We do advocacy, communications, outreach, grassroots organizing, and education. And our impact over the past 2 years since we started in the pandemic in April of 2020, we've had 16,000 advocacy actions. I think that number's up to 22,000 now. So those are Alabamians sending emails to their legislators, calling the governor's office, contacting them. That could be you. You too could call the governor's office. We've, in fact, called the governor 2,000 times. And of course, we speak with a nice staff person there, but we want her to know that Alabamians care about this. It says we have 112 coalition partners, but right now we have 116 actually. And we've been in the press talking about healthcare and the need to expand Medicaid over 40 times. You have probably, if you read AL.com or Alabama Daily News or Political Reporter or anything really, hopefully you have seen something about Medicaid expansion. I hope this isn't the first time that you've heard about it, but if it is the first time, maybe you're thinking, man, this is really messed up that I'm paying taxes for Arkansas to have something that I don't have. And man, this is really messed up. We could make money as a state off of just providing low-income workers health insurance. Or you're thinking, my God, I need this. I desperately need health insurance. I want a healthier future for my family. I want to be healthy. Maybe that's what you're thinking. And we would love to have you. We would love to have your organization, your group, your church, We'd love to have you as an individual sign our petition to Governor Ivey and stay engaged with us. If you sign our petition, and you can go to www.coveralabama.org and then /petition. If you sign our petition, you get on our email listserv. We send out about one email a month. We are having a call-in day on June 27th, which is the 10-year anniversary of that Supreme Court case that struck down, hacked off one of the legs on the three-legged stool. So, we would love to have your engagement with us. So next steps, what we're doing, we're engaging business leaders. We're really trying to get engagement with chambers of commerce, Kiwanis, social and civic groups all across Alabama to let them know why they should support this as a group. We're going to keep doing what we're doing because we think we've been doing a pretty good job. We're going to stay connected with Alabama lawmakers, the governor's office, people in Governor Ivey's administration. We're going to stay connected with them and tell them that we just want to be a resource and a help, right? There are very many ways that they can expand Medicaid. Not every Medicaid expansion program in every state looks the same. There are solutions she can do, around work development and other things, if she chose to do that. And again, she can make meaningful investments into healthcare, and the Alabama legislature could if they wanted to. And we have a whole plan that's laid out for them. If they want to, we've got it, we're willing to help. And we're going to continue to work with Congress and the Biden administration on solutions to make it even easier or more appealing for our state to expand Medicaid. Well, I have questions here. And if you do have questions, or if you want to get more engaged in this work, you can email me at info@coveralabama.org. Or you can email my Alabama Arise email, and that's jane@alarise.org. I'm honored to be here. I hope you've learned at least Medicare, gray hair, Medicaid, aid, aid for poor folks and the working poor, hopefully, if we expand Medicaid. I hope you have figured out why health insurance costs so much. And I hope that in the next year, you open up AL.com and you see Alabama expands Medicaid to 300,000 individuals. Because I think we're close. I think we're really close to getting this done. Have a good afternoon, or whenever you're watching this. And I appreciate the opportunity to talk and engage on this issue.
Okay, we really want to thank Jane for that very informative presentation and why that is so important to the citizens of Alabama. And if you can do any of those things, go online and do the website. It's coveralabama.org. And you can see there's a petition there where you can actually sign off on it, and it goes straight to the governor's office and straight to the legislators. So do at least do that. Lots of people, as she said, 300,000 would actually be able to get health care. Now, a lot of us have health care, and sometimes it's hard for other people to get out of their comfort zone and think about a person who doesn't have it. But this would be an opportunity for us to help all of Alabamians. Next week, I want to remind you we will have another guest, another exciting guest. He's a regular, Councilman William Carroll from District 2. He's going to come back on, and he's going to discuss what's happening with the Gafers project. I know most of you are aware of that. What they want to do with the old Gafers building downtown, put some apartment units in, and it's supposed to be for low to income level people. But according to what I have read, it is supposed to only be for folks who are working downtown. But it has hit some snags, and city council members are actually, some of them are actually against the project. They want some other safeguards in place. So let's listen in next week. He's going to talk about the Gafers project, and he's also going to talk about, give us an update on redistricting, because that time frame is winding down. I think it's like the middle of August. And remember, if the city council members have not agreed, then the mayor's plan goes into place. Okay? So they have until, I'm pretty certain it's the middle of August when that deadline is up. One other reminder is Stand Up Mobile is having a neighborhood canvassing, and it's going to be Saturday, June 25th. They're going to meet at Commonwealth National Bank in Tolmanville, and they will actually give you areas to cover, and they will canvass. You will actually knock on doors and talk to people about why they need to go and vote, who hasn't voted. You will have information with you where if they need to do an absentee ballot and those kinds of things. It's going to start at 8:30 and they will run until 10:30. So we're only talking about 2 hours. It is extremely important that we get as many people as possible registered, but we also have to do the voter education along with that, because to be registered and then still not go and vote will not help any of us. So if you have the time on Saturdays, or if you're a high school student, or if you're a college student, and you've got to do some community service for your high school or for your sorority or fraternity, come on down Saturday, June 25th from 8:30 to 10:30 at Commonwealth National Bank. Want to remind you of that. And that is the one on St. Stephen's Road. Okay? We again would like to thank our guest. She has brought us a tremendous amount of information, and now you understand why she's so hard to catch up with. She's all over the state giving this same presentation and trying her best to encourage people to become active and to advocate for your wishes with the lawmakers and with the governor. Because remember, all those people work for you. It's your taxes that pays their salaries. And like I said before, join us again next week. We will have Mr. William Carroll, and he's going to talk with us about the Gafers Project as well as where we are on the redistricting of Mobile County. We thank you again, and we will see you again next week. Same time, same place. And remember, our time is 3 o'clock. Okay? Have a wonderful day.